Assalamu alaikum. This video is reproduced for the ages of 40 plus when they start feeling pain in their joints, and especially after 50 on the knees. And then what they do, they don't study the thing, they don't make the first opinion, second opinion. So I have put all the 4 opinions in this video, and you can do whatever is suitable to you accordingly. And don't forget to subscribe the channel as well. Thank you.
Go away? Imagine eliminating that pain instantly without pills, doctors, or expensive treatments. I'm here to show you a natural, easy, and incredibly affordable way to eliminate knee and ankle pain. Pain? Imagine waking up with no discomfort, no stiffness, and no pain, without pills, doctors, or expensive treatments. Today, I'm going to show you a powerful natural remedy that has been used for centuries and works like magic. Stick with me until the end, and you'll be amazed at how simple yet effective this trick is. Grab a bowl because we're going to prepare an incredible pain-relieving mixture. Take 2 tablespoons of turmeric and add them to the bowl. This golden spice has been used for centuries to treat pain and inflammation. Comment below with your city. Let's see where everyone's watching from. Next, add 1 tablespoon of Vaseline. This will help the mixture adhere to the skin, allowing the active ingredients to penetrate deeply and work more effectively. Now add 2 tablespoons of coconut oil or olive oil. This is a secret ingredient trusted by older generations. Coconut oil. Are you tired of constant knee?
The exact cause of osteoarthritis is not known, but it runs a family, and most of the time it is wear and tear disease. So the normal mechanism of cartilage repair is lost. It runs in families, and it also affects people who do not have strong muscles, who have sedentary lifestyle, and who joints are affected in the past by injuries which are not treated, or infections, or conditions where, like in uric acid high levels, which will lead to gout, the crystals get deposited in the joint. And sometimes, if severe, it leads to deformity, difficulty in walking, especially climbing stairs, difficulty on sitting on the floor. How is osteoarthritis treated? Initially, the pain will be in heavy physical activity. Later, it will lead to normal physical activity. And this pain can lead to rest pain and pain disturbing sleep. This is the most important symptom. Pain is associated with swelling, and sometimes, if severe, it leads to deformity, difficulty in walking, especially climbing stairs, difficulty on sitting on the floor. How is osteoarthritis treated? This is treated based on the stage of osteoarthritis. There are 4 stages of osteoarthritis. Stage 1 is mild, stage 2 is mild to moderate, stage 3 is moderate to severe, stage 4 is severe osteoarthritis. 1 and 2, 90% of them are treated non-operatively with a simple modification of their activities, physiotherapy, and simple painkillers like paracetamol. In stage 2 and 3, sometimes we inject fluid, that means joint fluid, into the joint, which is low or not healthy in the knee joints. It helps. Also, we treat with PRP, that's a stem cells or platelet rich plasma injection into the knee joint, which might improve the quality of the cartilage. Also, might help to improve the repair of the cartilage. There is swelling of the joint, there is fluid in the joint, there may be loose bodies. This condition can be treated with arthroscopic surgery. That's a keyhole surgery where we put endoscope or arthroscope into the knee joint and use laser equipment to remove the loose bodies or remove the debris in the joint and remove the fluid, which will relieve symptoms. Which is severe osteoarthritis. That means you have pain on walking, pain on rest, and pain at night. That means your quality of life is affected. You are experiencing pain all the time. Nowadays, there is a remedy. In the past, maybe 30-40 years ago, these people used to suffer and used to die with severe osteoarthritis. Now, as most of you know, knee replacement is the solution, and the total knee replacement has changed the way we look at this condition in modern orthopedics. It has revolutionized the treatment. If it is done in the right patients, it's very successful. So now we discussed about osteoarthritis, which is a very common problem. As you realized, osteoarthritis is treated non-operatively in 90% of the patients. Only 10% of the patients need surgical procedure. And we have a great solution for those who need surgery, especially knee replacement. As I said, those who have severe symptoms affecting their quality of life should see their doctor and probably take treatment if it requires knee replacement. Nowadays, we do fast track knee replacement.
Which medicines can be used under which condition? Whether in winter or in general, most problems occur in the joints of hands and legs. Hence, in this video, we will talk about medicines that are used in joint pain of hands and legs. So let's start with the fingers of hands and feet. The first medicine is Ledempal. Ledempal should be considered lithium carb. Lithium carb is as similar and effective medicine as Ledempal. Lithium carb can be considered when there is swelling in the joints of fingers of hands or feet, and Ruta. Ruta can be considered when there is stiffness in the joint along with pain. Generally, Ruta is effective in those cases when the pain is aggravated in the cold and ameliorated by rubbing. Second is Colchicum. When there is feeling of weakness in joint along with pain and it seems difficult to hold anything, then Colchicum should be considered. Which generally people are most worried about arthritis. This is knee joint. However, these remedies can also be considered for elbow joint pains. The first medicine is Rustox. Rustox should be thought about when there is swelling, stiffness and pain in joints. The characteristic symptom is aggravation of pain while rising up from seat or first few steps post getting up in the morning. However, after some movement, the pain subsides. There is amelioration by continuous walking. Second is Bryonia. When there is swelling, stiffness and severe pain in the joints, one should think about Bryonia. Its characteristic symptom is completely opposite from that of Rustox. Here, aggravation is from movement and rest ameliorates the pain. Now we will see medicines for shoulder joint pain. The first medicine is Sanguinaria. When there is pain in right shoulder joint and shoulder joint pain, the first medicine is Sanguinaria. When there is pain in right shoulder joint and there is so much stiffness that it is difficult to even raise the arm, then Sanguinaria can be considered. Its characteristic symptom is that the pain is aggravated from movement and ameliorated by lying down. Second is Ferrum Mint. Ferment is exactly opposite of sanguinaria. There is pain in left shoulder joint with so much stiffness that it becomes difficult to raise the arm. However, here the pain aggravates by rest and is ameliorated by walking slowly. The first medicine is colocynth. Colocynth can be considered when there is pain and stiffness in hip joint and pain goes all the way down to the feet like the sciatica pain. Its characteristic symptom is pain is aggravated by gentle touch but is ameliorated by pressure or by lying down on the affected side. Second is formica rufa. Formica rufa can be considered when there is pain and all the way down to the feet like the sciatica pain. Second is formica rufa. Formica rufa can be considered when there is pain and stiffness in hip joint along with a feeling of restlessness. Its characteristic symptom is that the pain is aggravated in cold and is ameliorated by rubbing.
Joint pain. Arthritis and joint pain represents inflammation. Foods that are high antioxidant foods, high anti-inflammatory foods will help reduce that inflammation and relieve joint pain. I've looked at many anti-inflammatory foods, and I'm going to give you my top 3. Number 1 are the omega-3 fats. These are extremely anti-inflammatory. Most people are deficient in them. Omega-3 fats from fish like salmon, mackerel, sardines, all excellent for joint pain. Number 2 are the berries. All colorful fruits are good, but the berries are my top choice for anti-inflammatory joint relief. Number 3 is the spiced ginger. Now there's many wonderful spices. Curcumin is great, but ginger is the one that I really focus on. It is very anti-inflammatory, helps detoxify the body, great for the joints. Of course, there are many lifestyle factors that influence joint pain, but diet is a great place to start. So work with these 3 favorite foods of mine.